how important do you think trades education, helping people to be prepared for a job through that carries with it a union, the benefits of union participation. Right. How important is that for Washington? What's Washington doing to try and support that?
It's critically important. That's why I visited that location specifically, right, to see what's happening on the ground, right, building for the jobs for the future and opportunities for the future. So there's a number of things we're doing. I mean, one is making sure that young people know what the opportunities are for them if they want to pursue apprenticeship training, for example. So Washington State has some of the most generous programs for individuals who want that kind of training. So if you're at a certain income level, you can get that kind of training for free, right? You're eligible for that. You fill out a form, but you're eligible for that. So Washington has some of the most generous policies for young people who want to go into, for example, into the trades. And so I think we're in a good place from a state, but we can always do more. And I think I even spoke when I was in there a few moments ago about bills that passed this last legislative session for using apprentices on public work projects, for example. So making sure at each level, getting young people who want to go into the trades, for example, but also making sure we're providing the support for them, financially and otherwise, to make sure they can do that.
Quick question about the West Coast Health Alliance.
Sure.
So this is sort of a follow-on from the initial partnership between the states during the pandemic.
Correct.
Why was it important for Washington to join up with California, Oregon, and now Hawaii to sort of create its own streamlined channel on vaccines and public health?
I mean, look, it had to be done because of what's happening back in Washington, D.C. I mean, Robert Kennedy Jr., I mean, it's one thing to be a crank when it comes to public health, but it's another thing entirely when that crank literally is in charge of public health for our entire country. Setting vaccine schedules, appointing key people to the boards that set policy for public health for our entire country. I mean, the guy's a vaccine skeptic, and that's putting it charitably. I don't know if you watched his hearing a few days ago. I mean, it was a total train wreck. And so, look, as a governor of this state, and I'm speaking as a governor, but also as a parent of teenagers, right, that we simply can no longer be tethered to the policies from Washington, D.C. when this guy's in charge. That's not good for public health for our kids or for our entire state. And so, yes, the governors of Oregon and California and I were kicking around the idea of joining forces again and decided to go forward with that. And a couple things I'll say about that is, number one, what that allows us to do is to rely on something that I think Washingtonians want, rely on science, rely on data, rely on actual facts. That's how you guide public health. And the state of Florida is going entirely the opposite direction, right, in this sense, as is the federal government. Number two, that alliance is growing already. Hawaii, as you said, wants to join. The governor of Hawaii, Governor Green, he's an actual doctor. He was like first one, hey, can I join in? And so what we're going to have in Washington State are vaccine schedules, for example, that are based on science. We're going to have availability for vaccines for everyone who it's appropriate. And the response has been very, very positive as I've been traveling the state since that announcement just in the last few days. And it's unfortunate we have to take this course of action, to be perfectly honest, but we're fortunate that we live in a state and have this coalition that is very strong and is grounded in the science. So we're optimistic about the future on that.
Governor Pritzker in Illinois is dealing with threats of federal action in Chicago. A couple of months ago, maybe a month and a half, Secretary Noem with Homeland Security said, well, we're so secure at the southern border that now the northern border is the corridor for drug and human trafficking, which makes a lot of people think, well, could Seattle be a future target, the state of Washington more generally? What are you hearing about that, and what are your concerns in that direction?
Yeah, I mean, obviously what we see is what you see in the news, right, where these federal folks are saying they're going to go into so-called sanctuary cities where they think crime is rampant. If that's really what they want to do, let's just take them at their word for a moment, right? I have some news for them. If you look at, for example, the top 20 cities in the country that are ranked for homicides, guess what city is not on that list? Seattle. In fact, it's nowhere near that list. The majority of cities on the list, again, the top 20 cities for homicides in our country, the majority of them have Republican governors and are in red states. So I really encourage President Trump, if he actually cares about public safety, maybe he should look at those jurisdictions. Why is he not doing that? You know the answer as well as I do. It's all politics. That's all this is. If he genuinely cared about that, He'd be going to the cities that are ranked at the very top for homicide rates, not looking at cities that are nowhere near the list of the top 20. So, but that's just the way things are right now with the federal government, and it's unfortunate it's come to that, to put it mildly. And as you might imagine, we of course are having conversations to prepare as best we can for this. We don't need their help. We don't want their help. We think if they actually cared about public safety, they would focus on the cities where they have the greatest need.